For weeks, Indonesia, a country with a population of around 270 million people, has been reporting thousands of daily cases and hundreds of deaths as the extremely contagious Delta variety has ravaged the country. Users who have lost loved ones to the virus have filled social media with posts. Hospitals are running out on supplies, workers are hastily digging funeral grounds, and isolating for millions like Suharyanto who live on a daily salary remains impossible. The country is also dealing with extensive and widespread misinformation, as well as a vaccination rate of less than 6%. Onlookers warn that the country may not have hit its peak, with more than 2.7 million people sick and more than 70,000 deaths. Indonesia managed to keep its COVID-19 epidemic under control for much of last year. The International Federation of Red Cross and Red Crescent Societies warned Indonesia was on the verge of a COVID-19 catastrophe as cases increased in June, overwhelming hospitals. Indonesia's health minister, Budi Gunadi Sadikin, stated earlier this month that the country has observed a dramatic surge in confirmed cases following the Christmas holidays. He attributed the surge in cases to the fast-spreading Delta variety, which was discovered in India and has since spread to over 100 nations. On July 10, Indonesia declared a state of emergency, citing a daily rate of more than 30,000 new cases. The government has stated that it is mobilizing all resources to deal with the COVID-19 outbreak, including importing oxygen from other nations to boost supply. However, experts claim that Indonesia is now paying the price for failing to lock down early enough. And the current figures are unlikely to reflect the full story. According to data from Johns Hopkins University, more than 27% of tests are positive, making Indonesia one of the countries with the highest test positivity rates in the world. According to the statistics, many cases are still undetected. According to a poll released last Saturday, nearly half of Jakarta residents may have contracted COVID-19, which is more than 12 times the number of cases officially registered in the Indonesian city at the time of the study. Without appropriate testing, many provinces are unable to isolate confirmed cases on time, the World Health Organization said in its most recent situation report. The flow of misinformation is another key impediment to controlling the outbreak in Indonesia. For months, bogus news regarding unsuccessful COVID-19 therapies has been disseminated via WhatsApp conversations. Hoaxes regarding the vaccines have gone viral on social media, scaring some people away from getting the shot for fear of contracting a fatal illness or dying. Many people in Indonesia are still not taking COVID-19 seriously due to disinformation, despite the fact that cases are increasing all around them. Warnings regarding the severity of COVID-19 are getting lost in the shuffle. Families do nothing to safeguard their children from the virus, and even when they are afflicted, parents sometimes mistake the illness for a typical cold. Schools were closed last year and are now closed again as part of the new lockdown, although Indonesian students are on summer vacation. According to an article published last month by Yajan Sastramajaya, an associate fellow with the Regional Social and Cultural Studies program at the Yusof Ishak Institute in Singapore, and Amirul Adli Rosli, a research officer at the same institute, the broader issue is continuing skepticism about COVID-19. Indonesia's crisis is increasingly resembling India's second wave, with oxygen tanks in short supply and people hopping from hospital to hospital in search of treatment. Patients were traveling for hours to receive crucial medical attention, according to Sudirman said, Secretary-General of the Indonesian Red Cross. Vaccines are Indonesia's best option for combating the escalating pandemic, according to President Joko Widodo. Fair and equal access to vaccines must be guaranteed since we see there is still a wide gap in vaccine access throughout the country, he said, according to Antara News. The White House stated earlier this month that it would deliver 3 million doses of the Dilong vaccine to Indonesia to help combat the outbreak. More than 3 million doses of AstraZeneca's COVID-19 vaccine arrived in Indonesia on Tuesday as part of the global COVAX program, making it the eighth supply to the country. According to official media, the campaign has resulted in the distribution of almost 14 million immunizations in Indonesia. However, for the millions of people who have already been harmed by COVID, such immunizations will be too late.